All right, today we're going to do a anterior composite. This is our setup right here of all the supplies that we need. We do have Bob in the chair today, and Bob is going to get a anterior composite on tooth number 8. So before the doctor comes in the room, I'm going to check the shade to kind of get a preliminary shade to see what color anesthetic we want to do. All right, that looks good. Okay, all right, Bob, we're going to go ahead and get you numb for the procedure right now. What we want to make sure we do is we dry the area before we place topical. So here's our topical on our 2x2. We're going to dry the area. Dry that area good. And you want to go right in with your topical. You don't want to wait because then saliva is going to get in that area and it's going to dilute the topical. Okay, that's going to stay in for a few minutes. We're going to get our syringe ready to pass. Remember, we want to have the anesthetic facing up so the doctor can see what type of anesthetic we're using. And always check the expiration date. Okay. So we'll put the topical right here and pass that to me. Good. There we go. And then we're going to pass thumb, fingers, slide. Cap goes right into your recapping device for the doctor. And then we're going to reach for our air water and our saliva ejector right away because we're going to rinse that area as soon as she's done giving that injection. Hang in there, Bob. Here we go. I'm just going to rinse that out for you. Just a little bit of water in that area. Okay. There you go. All right. Okay, Doc, I picked shade number 69. You want to verify that?
Perfect.
Perfect.
Yes, we want Bob to look good when he leaves here.
All right, good. So she's going to take a look at that. So we're going to pass the Mirror Explorer right into the doctor's hands so she can go in. And we're going to take a look at that tooth. She wants to take a look at that. While she's examining the tooth, I'm over here getting my HVE and my air water ready because when she's done, we're going to go ahead and start drilling on that tooth. Perfect. All right. So we need to make sure that our suction, if you see which way her burr is facing there, so I want my suction to be whatever angle her burr is facing. So if she's going this way, I'm here. If she turns and goes to the incisal edge, if she comes up here, I want to be down here. So you want to follow the direction of the burr where your HVE is. Now sometimes you'll have to drop down to get any excess water that's built up. So I want to be like this. Then if she goes the other way, I'm going to turn, I'm going to be here. Okay? Good. So when she's done with the air water, I'm going to turn my suction on. Air water and air. Okay? Now she's here. So if water builds up, I'm going to just drop down and come right back up. Now she's done, so I'm going to do air, water, and air. Just to dry off that tooth so she can take a look and see if she feels comfortable with what she's drilled out of there. Okay, so doctor will take a look. Maybe there's a little bit more decay in there she wants to get out, so I'm going to pass the spoon excavator right into her hand. I'm going to get ready because I'm probably going to rinse when she's done carving out that decay in there. So she's scooping that out. I'm going to take that back and then I'm going to rinse it for her. And always air so that they can see. So she's going to look and make sure that she's good.
We are good.
We are good. All right, so next, because the sides of the tooth are missing or the mesial and the distal are missing of that tooth, we need to put on a matrix system. So for the anterior tooth, we're going to use a celluloid strip. So it's a clear strip like this. Okay, I'm going to pass that to the doctor. Take her mirror.
Okay.
Kind of hard on the, you doing okay there, Bob? Hang in there. Now we're putting a wedge so that we can wedge apart to be able to keep that embrasure space in between those teeth. Good. Okay. Good. All right, now let's put some isolation up there for you, Doc, so we can keep that lip up. Good, there we go. Keep it nice and dry. Does that help a little bit?
Yes,
There we go.
looks good.
Perfect. Okay, so you want to isolate the tooth so we can keep everything out of the way. The next step is we're going to prepare to do the filling. So we need to etch the tooth. So the etch is preparing the tooth to receive the filling. So I'm going to give her the etch, let her dispense a little bit out onto my 2x2. I'm going to grab my HV and my air water so that I'm ready. I'm going to take the etch back from her, and it's going to sit on the teeth for about 15 to 20 seconds. Now, when that time's up, what you want to do as the assistant is we want to suck up as much of the etch as we can, and then your doctor's going to rinse. So do you see how I'm very close getting all of that etch up there, because it tastes really bitter if you don't get it all off. Okay? Good. Once she starts blowing air, then I can be out of there. I'm going to go down and make sure there's no saliva or anything down here. And now we're going to come over. Now we're going to start the primer. So we're going to have our micro brush. And this is our little bin that has a shield over top of it because our material is going to be light cured. Okay, so I pass the micro brush. I'm going to open and I'm going to block. If you can see, I'm blocking where I don't want her to go. So I want her to use the primer that is here. While she's doing that, I'm getting my HVE ready. You always want something in both hands. Okay, she's going to take that. You want to close this up when you're not using it. She's going to blow air, and I'm going to hold my suction right here to get any of that primer that comes off. Okay, now we're going back. I have a different colored brush, and now I want her to go in the bonding. So I'm covering here where I don't want her to go. Close this up. I'm coming with my HVE. She's going to blow some air. Okay, now we're going to go to a little bit of flowable material. So your flowable material, oh, I'm sorry, we have to cure it. My fault, let's cure that.
I'll let you go ahead and cure.
Thank you.
All
We need to
right.
cure. Good, and you see I have the paddle. So make sure that if doctor's looking at it, that we're blocking so that she can see. Okay, there we go. All right, now we're going to go with a little flowable.
All right.
She's going to dispense.
Okay.
Now for flowable, it's very, very thin. So you want to get ready so that you can cure that right away. Okay, I'm keeping that in my hand and I'm curing. We don't want to wait because that flowable will go out from wherever we want it to be.
Beep.
All right. Now we're using a packable, which comes in a gun here. So this is a little bit thicker material. So I'm going to hand it to her. Plastic instrument so that she can move that material around. And then a 2x2 so that she can wipe it off. And then she might want some bonding agent to dip that in. The bonding agent helps it so that the composite doesn't stick to your instrument. So if you see, I have bonding here covering the two areas where I don't want her to go and a 2x2. So she's manipulating it around. How you doing there, Bob?
Oh, it's good.
Bob's doing good.
Okay.
Okay, so now that material has to be cured. So we're gonna cure. Beep, beep. Okay. All right, then Dr. might go back a couple of times depending on how the composite is done. Okay. All right, does it look good, Dawn?
It looks great.
Okay.
I think we can go ahead and remove.
Okay, so hand out to take it from her. She's gonna give me the wedge, the celluloid, and the cotton pliers. Okay, all right. So you wanna floss that area, see how we're doing? So floss, we're gonna hand to her so she can just grab it and go in.
Okay, I think we've got
Good.
good contact.
Okay, you wanna check the bite?
Sure.
Okay. All right, Bob, we're gonna have you bite down on this for me. Make sure that we're not too high with that restoration. So we're checking to make sure that he's biting correctly like he was before he came in or like when he had a full tooth in there. Okay? All right. So now the doctor's gonna shape up that composite. So we cured the material with the light, so now it's hard. So now she's gonna shape that into a tooth. There we go. Sorry.
Okay, yes, we'll have you back in business here, Bob. All right.
So sometimes you have to twist your HVE to get wherever she's going. You see how she's changed it around a little bit?
Okay, let's check articulation.
Okay.
And
So I'm not gonna put these things down. I'm gonna hold here because we could go back and forth with the articulation. All right.
may I have the mirror also?
Right. Good.
Okay, let's just take a quick look. Oh, that looks great. That looks great. So let's do a little polishing.
Okay, perfect. All right. So now here she's gonna polish. So this handpiece is a slow speed handpiece and doesn't have any water coming out. So as the assistant, we need to make sure that we're dripping water. So we're just gonna drip water a little bit on there. Just drips. So you see that? I'm just dripping. I'll come up higher so you can see. I'm just keeping the tooth wet for her. Now if we get water down here, we have to go get it and come back.
Okay. All right.
Good, okay.
So should we check the interproximal and
Yes.
the strip?
All right, how's it feel with your tongue there, Bob? Does it feel pretty good? Right.
Yeah.
Okay, so now she's gonna go in between the teeth on the mesial and distal. How do you wanna grab that? There you go.
There you go.
She's gonna go in between and make sure that it's nice and smooth on those interproximal surfaces.
Okay.
Good, okay, all right. Now, when the patient is all done, we're all done with that, Bob. I'm gonna go ahead and get all that cotton out of your mouth and give you a nice, good rinse. Okay, so when I'm rinsing, I'm gonna have the patient turn towards me. He's gonna turn a little towards me. I'm gonna put my HVE right down here by the retromolar pad. So right here, I'm gonna wet that cotton, give him a good rinse. Nice, good rinse. Okay, I'm gonna turn this off. This goes in one hand. I'm gonna come in with my cotton pliers and I'm gonna grab this cotton roll. There you go, Bob. That, whoop, we'll get that out of there for you. That feel better? How's everything feel? Good? All right, you are all set.